ReMar nurses, welcome back. This is how to pass NCLEX. And if you have your notifications on, you know that something very special is coming up. We have our NCLEX Scary Topics Review is coming up soon. Our NCLEX Scary Topics Review is coming up soon. We want you to be a part of it. In fact, I have to let you know that the date is wrong. I'm sorry, I got the date wrong on that. It is October 20. Topics review is coming up soon. You have to forgive me. I haven't had no sleep for the last, 72 hours. Most of you know that Regina and I, we have brought home our third child, Shiloh Jean Callion, and we are so excited. But as a result of that, we have no sleep. And so we're a little bit sleep deprived. But listen, NCLEX Scary Topics is coming up on October 29th. That is on a Thursday. And we want you to sign up so that you can get your workbook. We want you to sign up so that you can get your workbook. Hello, everybody. Hello, everyone. Thank you for joining me on this late Monday night. Thank you for joining me on this late Monday night. The link is in the description for you to sign up, okay? For the NCLEX Scary Topics Review. So you sign up, you drop your email, and then this week we will send you that workbook. It's a 2-hour NCLEX review hosted by Regina. And so she's going over some of the most scary topics on NCLEX to help build your confidence and give you that content that you need to conquer the NCLEX exam. She's going to be talking about select all that apply, talking about pharmacology, talking about fetal heart rates, and then also scary and strange diseases. Today, we have a lot of NCLEX questions for you, and we're on the topic of psychiatric nursing. So we have that for you. And the motivation today is called I Signed Up for This. I signed up for this. Right now, there are over 6,300 nurses in the ReMar virtual trainer studying right now. And so many nurses are passing NCLEX that we decided to do something amazing. We are throwing a party. We're throwing a celebration for all of you who have passed NCLEX this year. And what we're asking you to do is simply drop your video testimonial, record your journey to help encourage the next ReMar nurse. And we're inviting you to our NCLEX party, our celebration with Regina MSN RN, the #1 NCLEX instructor on the planet. And so we want you to be a part of that. When you do your video, you also get your ReMar Nurse, official ReMar Nurse blue t-shirt, and you can wear it proudly. If you are studying for NCLEX or need help studying for NCLEX, please visit remarnurse.com. But right now we are going to get into our questions without further ado. Here is the first question for today. Here's question number 1. A home health nurse cares for an older adult client with a hemoglobin of 9.5 and a hematocrit of 30%. Which action does the nurse take next? Which action does the nurse take next? Is it number 1, get a prescription for another hemoglobin or hematocrit? Is it number 2, check the orthostatic blood pressure? Number 3, call the healthcare provider to report the labs? Or number 4, does the nurse send the client to the emergency room via ambulance? What do you say? What do you say? The home health nurse is caring for the older client, adult client. This is an adult, has a hemoglobin of 9.5 and a hematocrit of 30%. Which action does the nurse take? Number 1, get a prescription for another hemoglobin and hematocrit. Number 2, check the orthostatic blood pressure. Number 3, call the healthcare provider and report the labs. Or is it number 4, send the client to the emergency room via ambulance? What do you say? What do you say is the correct answer? What is the correct answer? All right, I see a lot of 2s, a lot of 3s. A lot of 2s, a lot of 3s. I'm gonna give you guys 10 more seconds, and see what you have as the right answer. Okay, YouTube has a lot of 2s in there. Thank you all congratulating us for the birth of Shiloh. It's an amazing miracle of God. And we are so happy to be a part and play that role. But we're also so glad that you are here, part of the ReMar Nurse audience. Let's see what the answer is today. All right. We have the answer. The answer is number 2. If you said number 2, go ahead and give yourself a hand clap, but not too loud because your house is probably sleeping right now. All right. So number 2 is the correct answer. That the nurse should check the orthostatic blood pressure. The nurse should check an orthostatic blood pressure next because the client with anemia may have orthostatic hypertension. All right. So number 1 is not the most appropriate in terms of getting the prescription for another hemoglobin or hematocrit. The nurse should not get the prescription to have those done, to have those checked. All right, soon. Number 3 is not the most appropriate. Call the healthcare provider and report the labs. The nurse should do a further assessment before calling the healthcare provider, as the provider will likely want additional information. Number 4 is not the most appropriate, to send the client to the emergency room via ambulance, because sending the client to the hospital may be needed, but the nurse should assess the situation further. All right, further assessment is needed. How did you do on question number 1? If you got it right, awesome. If you got it wrong, hey, it's okay. You are in the right place. You know what notes you need to take and to be able to go back and study the content in that area. But listen, don't get discouraged. We're going to move right on to question number 2. Question number 2 says, which client should be seen first at the start of the shift? Which client should be seen first at the start of the shift? Number 1, the client scheduled for outpatient surgery at 10. Number 2, the client who has a blood glucose level of 64 at 7:30. Number 3, the client who reports a headache pain 5 out of 10. Or number 4, the client with an arm cast placed 4 hours ago. Which client should be seen first at the start of the shift? I'm not going to give you a lot of time on this one. Either you know it or you don't. Shout out to all of the ReMar nurses passing NCLEX. Trisha, we see you. Trisha Love, congratulations on passing NCLEX. Said, hi, Regina and Mark. First, I want to thank God. God bless you and your family. Passed my NCLEX RN on October 17th. Congratulations. Listen, we want to send you, we want to see that video so that you can join the party and get your tea. In fact, the link to share your video will be in this video description. So make sure you check that out. All right, ReMar nurses, what did you say? Is it number 1, number 2, number 3, or number 4? This is all about critical thinking. Here we go. And the answer is, boom. Answer is number 4. Ooh. Answer is number 4. All right, so let's look and see why number 1, 2, and 3 were not the most appropriate for which client should be seen first at the start of a shift. All right, so number 1, the client scheduled for the outpatient surgery at 10 or at 10,000 at 1,000. It says the client scheduled for surgery has needs, but it's not experiencing an emergency. All right, so it's just the time that they're scheduled for it, but there's no specific emergency listed right there. Number 2, the client who has a blood glucose of 64 at 7:30. The client with the glucose level of 64 requires intervention such as a snack. However, it is not a life-threatening condition at this point. Number 3, the client who reports a headache pain 5 out of 10. The client with a headache pain 5 out of 10 should be seen, but not before the client with a possible compartment syndrome. All right, possible compartment syndrome. Number 4, the client with an arm cast placed 4 hours ago. The client with a newly placed arm cast is at risk for compartment syndrome, which is a medical emergency. So that client should be seen first. So this is just ranking which is most likely to be that medical emergency. Now, listen, we are going to move on to our third and final question. Let's see how you do with question number 3. Question number 3. Here we go. Here we go. Which is the highest priority action that the nurse should perform before initiating peritoneal dialysis? Which is the highest priority action that the nurse should perform before initiating peritoneal dialysis? Number 1, is it determine the client's weight? Number 2, administer pain medication to the client. Number 3, provide the client with oral fluid. Or number 4, place the client in a high Fowler's position. All right. 1, 2, 3, or 4. 1, 2, 3, or 4. In fact, on this one, after you write your answer, I need you to do me a quick favor and just go ahead and share this video so other nurses can get the information and know exactly what's going on with the #1 NCLEX review, hosted by the #1 NCLEX instructor, Regina MSN, RN, and her study buddy, Mr. Mark. All right, let's see, guys. What do you have? Is it number 1, 2, 3, or 4? Also, if you're watching on YouTube, make sure that you subscribe because you never know when we're going to pop up. And you want to also turn on your notifications so that you don't miss a beat. Let's go ahead and look at what is the answer for question number 3. Question number 3, the answer is number 1. The correct answer is number 1. What is the highest priority action that the nurse should perform before initiating peritoneal dialysis? Number 1 is to determine the client's weight. It is the duty of the nurse to collect and monitor the client's weight before and after dialysis to determine the amount of fluid that is removed. All right, so before peritoneal dialysis, it is the duty to determine the client's weight as a measure of how much fluid is removed before and after. That is the correct answer. Number 2 is not the most correct. Administer pain medication to the client. There is no indication that the client is in pain. Number 3, so don't read into the question there. Number 3, provide the client with oral fluid. The client should not be given oral fluid as the weight should be established. Number 4, place the client in the high Fowler's position. The client should be placed in a position of comfort, such as a low Fowler's during the procedure. High Fowler's is not recommended for the client receiving peritoneal dialysis. All right, guys, there you have it. Questions 1, 2, and 3 for today. How did you do? I'm hoping that you got them all right, but if you got some of them wrong, it's okay because we have a study system that's going to help you build up your content and build up your confidence. And just by you being a part of the ReMar Nurse family, it's going to work out. All right. So make sure that you put in the time and that you would continue to grind towards your goals and look up, go back. And if you didn't get something right, go back and look it up. All right. Spend that time, that quality time where it really counts. And one thing I want you to do, everybody needs to do right now, is use the link in the description to sign up for Regina's Scary NCLEX Topics review. She's going to be reviewing pharmacology, fetal heart rates, strange diseases, select all that apply, and more. All right. That is coming up October 29th. October 29th. So make sure you sign up now for your free workbook, and so that you will get that, so that you will be able to use that workbook as you're going through the class. All right. Also, have to let you know that with the Scary Topics review, you get to see what it's like to really review the content with Regina. And the full program that you're able to do that right now is 80% off. But I have to tell you, the sale is ending soon. The sale is ending soon. In fact, the last day of the sale is going to be October 31st. Isn't that scary? That's a scary topic, right? All right, the sale is ending soon. Right now, get 80% off your NCLEX virtual trainer subscription. The virtual trainer comes with your virtual training center. That's your online NCLEX review course with 90 days access to Regina's study lectures to help you break down the core nursing content, build your confidence, and it's only the need to know content that you need to pass NCLEX. It comes with your virtual trainer workbook. It's detailed fill in a blank workbook. It organizes your NCLEX training, easy to understand, and it's a minute-by-minute study routine for you. Also, your quick facts for NCLEX has the pharmacology section, all new case studies, clinical lab studies, and it's straight to the point core content. It is the fundamentals information that you need to pass NCLEX, all wrapped up into the NCLEX virtual trainer. And right now you can get the full program for just $129 at remarnurse.com. Now listen, I know some of you watching right now have just passed NCLEX last week. If you passed NCLEX last week, I need to know what size shirt do you need? What size shirt do you need? If you've passed NCLEX with ReMar this year, type in the comments what size shirt that you need, and we'll send you the link so that you can join the party and get your ReMar Nurse shirt. All right. We've been sending so many shirts out, because so many of you have been sharing the good news of passing NCLEX. And what I'm doing is I'm calling everybody personally that has passed NCLEX this year with ReMar, has hit the link and done their video. I called one of the nurses, one of the ReMar nurses, and she was like, She was like, hello, hello. I was like, hi, what's going on? Are you okay? She said, I'm at work right now. I said, you are? You at work? Praise God. How about that? I love it. I love it. I love it. Listen, I want to call you and say congratulations. And you say, I'm at work right now. So I can't talk too long, but I'm going to listen. Y'all know how y'all do. All right. So listen, do that for me. Let me know what size shirts you need, and we'll send you the link so that you can join the party and get your ReMar tee. All right. Now it is time for our ReMar roses, ReMar roses, ReMar nurses. It is time to get your roses. And listen, every week we'll show you maybe 3 or 2 or 3 or 4, but the reality is there's at least 50 to 100 nurses that are passing NCLEX, doing their testimonials, but we just don't have time to share it all. But today I want to give shout outs to a special nurse giving roses to Nurse Kathy. She's actually on right now. This is a nurse who is still on the grind. She is still preparing for NCLEX. She is not passed NCLEX just yet, but she is working. And she says, my study partner, happy Sunday, everybody. I don't have, and I don't want a plan B. Never give up. She says she will be an official ReMar nurse. She will pass NCLEX. She doesn't have a plan B. She doesn't want a plan B. Plan A is to pass NCLEX and provide for this beautiful baby right here who is with her studying. All right. And I can really relate to that, Nurse Kathy, ReMar Nurse Kathy, at this time, because, you know, we just brought home our bundle of joy, Shiloh Jean. She is now home. She was born at 8 pounds, 5 ounces, 20 inches long. And we just brought her home on Thursday. So, I mean, we are really team no sleep. But the reality, the truth of the matter is, I signed up for this. I signed up for this, guys. Listen, you guys know that last Friday before last was supposed to be the day Regina went in, and it wasn't the time. So she was turned back, and we had to go in on Monday for a baby stress test. And then when we got in there Monday, they were like, you know, we're going to keep you. Okay. And so Tuesday came, and so she delivered on Tuesday. And so we had to stay Wednesday, and then we were able to discharge on Thursday. And then we've come back home. And ever since we've been home, it's been team no sleep. Let me tell you about it. I mean, I'm talking about diapers and wipes and bottles and burpees and all of that stuff, all of that good stuff. And when we picture having a beautiful bundle of joy, you know, this is what we think about right here. This is Shiloh. This is Shiloh, guys. I just want to show you to her to the aunties real quick. But this is Shiloh right here, and this is what you think about when you think about having the baby, right? That's what you think about when you think about having the baby. But what you don't really think about too much is all of this action, right? What you don't think about are waking up, in the middle of the night or sleeping in a 2-hour rotation and having to do all of that work of just, making sure that this child, this gift that God has given you stays alive and well and fed and cleaned and nourished for all of her life, all right, until death do us part, as the saying goes. I mean, you don't think about all of those things, but the fact of the matter is we signed up for that. We signed up for not only the cute stuff, but we signed up for changing diapers and and wiping noses and not getting any sleep. We signed up for all of that. And so what I want to tell you is, with your nursing career, it's not always sexy. The journey is not always flowery and everything like that. You're going to be up late at night. Sometimes you won't be able to sleep because you've had to study and cram, or work that extra shift to be able to just pay for take boards, or to pay for your study materials, or whatever the case is. But the fact of the matter is that you can't give up on your dream. You can't give up on your goals, because you signed up for this, and you have to know exactly what you signed up for and be prepared to answer. Be prepared to answer. All right. So listen, even though you signed up for this, okay, you have to stay focused. Stay focused. It's going to be team no sleep every once in a while, but keep grinding. You are a ReMar nurse. So that means you don't give up. You don't give in. You put faith over fear, right? When it gets too hard, you might cry a little bit. You might break down. Ask God, why? Why haven't I passed yet? Why has it been so long? Why is this so difficult to grasp? But you signed up for it, all right? And if you stay with it, it's going to grow. Shiloh, she's not always going to be a baby. She's going to blossom into a beautiful young lady, a beautiful young woman, and all of the fruits and all of the efforts, Lord willing, we'll receive a return on that. But listen, even though you signed up for it, it's still good. It's still good to have some encouragement every once in a while, right? So we know it's difficult, but we are here at ReMar Review to encourage you. So here's a piece of encouragement I did for Regina, because I know she's watching.
I love you, Mommy. Hey, Mama. You're the best mom in the world. In the whole world.
Remember, no matter how bad it gets at times, guys, there's still going to be good moments. You're still going to get your license. You might have some sleepless nights, but at the end, there's going to be some smiles. All right. And that's what we want to let you know, is that we encourage you on this journey. Yes, you signed up for it, but you still need some encouragement at times. And that's why we do Monday Motivation, is just to remind you that you're going to be an amazing nurse, to remind you that God has a career ahead of you, that he's called you into a career to give yourself in the terms of being helpful to others, to be a healer for others, to be a blessing to others. That's the reason why you're here. You signed up for it. So we just want to encourage you and let you know that we love you and you're going to be amazing. Okay. It might be some sleepless nights. You might have to change a few diapers, might have to change a few bedpans. You might have to start off working in a nursing home and not the position that you thought you were going to start off at, right? But you signed up for it. Okay. So you can handle it. And right now, I want you to sign up for the NCLEX Scary Topics Review, guys. It is coming up. You don't want to miss it. It's going to be amazing. Okay. It's just another way that we can help encourage you on your nursing journey. And also remember, if you need help with the NCLEX virtual trainer, get it right now, only $129. This sale is ending at the end of the Scary Topics. All right. So 10/31, October 31st is the last day for the NCLEX virtual trainer sale at $129. So we don't want you to miss out on that. Sign up for the Scary Topics NCLEX review. The link is in the description and we will have that for you. And also just a reminder that the NCLEX party, ReMar Nurse NCLEX party, is coming up soon. So if you have passed NCLEX with ReMar in 2020, make sure that you're doing your video so that you can get your t-shirt and join the celebration. All right. To God be the glory for the great things that he has done and the things that he's doing for you in your life. Thank you so much for being a part of the ReMar Nurse family, the ReMar Nurse audience, the ReMar Nurse community. Sign up for the NCLEX review, share this video so that more nurses can be a part of it who are struggling, to help them get over the hump because they signed up for it, and we are here to help and encourage. All right, guys, we love you. Have a good day and God bless.